Have you ever had a time in your life where you received a service from any service provider and it just made you want for more and want to come back for more? It left such a good impression on your mind. You felt so empowered and positive out of that experience. And you left obviously good reviews and you recommended it to everybody. And that place became your go-to for every time you wanted that particular service. That's the kind of experience that we want to deliver to our patients as healthcare providers when we are quote unquote serving them. Now there's many ways in which you can do it, and I'm going to cover some of those elements in this video. So to know what they are, stay tuned for the rest of the video. Welcome back everyone to my channel. For those of you who don't know me, my name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps healthcare providers from a non-English speaking background, so in other words, English is their second language, become better, more empathetic, impactful, and authentic communicators whilst improving their English language fluency, for the ultimate aim of becoming better healthcare providers who can connect and relate better with their patients, build trust with them, become a more credible healthcare provider, and consistently deliver patient experience in a more positive manner at all times. So as I mentioned in the very beginning of the video and what I mentioned just now, we're going to be looking more into the concept of patient experience in this video. So one of my LinkedIn posts, I'm just going to leave the link over here to that one. That's where I differentiated between what service is and experiences. So in the healthcare space, these two words tend to be interchanged quite often. And yes, there are a lot of similarities between them, but fundamentally they mean completely different things. Let me just use an example as, say, if you're going to a massage parlor. So I was in Bali a couple of months ago, and one of the things that I did on my last day there was I got myself a massage. And if you go anywhere around Bali, you will see that there are so many massage parlors. And if you've been there or to any places where massages are a big deal, even Thailand for that matter, people will just be sort of standing outside and they'll be asking, oh, do you want a massage? Do you want a massage? So you just want to sort of rob you in. I personally didn't find that very appealing, to be honest with you. I like to go to a place where I feel drawn, where I feel like I feel like a pull to that place. And there was this one particular place that I decided to go to after getting my tattoos done. So it was on the same day before I flew back home. So this place was very fancy. And so I walked in there and it looked amazing. And I remember when I went there and got my time slot booked, I could see how well the service staff, they were taking care of their clients. So they were giving them tea, they were giving them refreshments, they were giving them hand towels just to cool themselves off. And so I got a good feeling about it. I was like, yeah, this is a good place to go to. And it was very spacious and it was very nice. So it was set up quite well. So, and then obviously when my massage was done, it was completed, I felt like $1 million. I felt amazing. I felt on top of the world. And yeah, I just, not only did I pay them, the $20, which is nothing for a shoulder and head massage for like 1 hour. And, I paid them and I even gave them an extra tip, and it was just incredible. So in this particular example, the way the space was set up and the way that they were taking appointments, the way in which they were talking to their clients, they were taking care of them and, providing them with everything to make them feel comfortable and relaxed was what made up part of the service. The overall experience, the overall of everything that they did, so combined, how they spoke to their clients, what the actual massage was, how they, took care of their clientele, overall from start to finish. That's what makes up the experience. So anybody can provide a service. Like, for example, I'm providing a service to you guys when I'm making these videos. But to actually learn, to become a better communicator, you have to, quote unquote, experience it with me. And that's where the concept of experience and service are different. So I just wanted to clarify that before we go into this video. So a lot of elements go into making up what patient experience is. And I'm not going to be able to cover all of them because we'll be here forever, but I will sort of attach over here this big little A3 picture or a poster, as I call it, and this is something I made during my retreat in Bali, so something I did with my coach. And all of these elements make up what's considered to be a very comprehensive and complete patient experience, and there's a lot of things that you can add to it. So this is the complete picture. I'm just going to cover about a couple of them, or 2 or 3 of them, and I'm going to look at that in much more detail. So let's get into some of the elements that are, I think, not talked about very often. So, some of them are pretty obvious. If you look at the poster, say for example, you have to listen actively, you have to be empathetic, and I talk about this all the time. So I'm not going to go into that so much because it's quite self-explanatory. I'm not going to also go into things like, say, conflict management. So that again is one of the things, because that in itself is a big concept and a big video. So without getting too negative, let's look at a couple of things, or 2 or 3 concepts that we can do as healthcare providers in order to create a well-rounded, wholesome, holistic, and empowering patient experience for our patients. So let's get into it. The number one the number one point that I would like to make is the importance of self-awareness and reflection. So if you actually enroll into my coaching program, and if you, when you start learning about how to become a better communicator, this is actually one of the very first things that I cover in my coaching program. And you might be wondering, why you are really delivering a service to your patients. How do you come into the picture? Well, self-awareness is everything. It really goes into why we do what we do, how we show up for our patients, how we communicate with our patients, and how we connect and relate with them. So self-awareness is what it sets the foundation for everything that we show up. We may not actually be doing it consciously or really thinking about what we're saying or what we do, but if you have better clarity of who you are and what you want to achieve, and even the purpose behind why you're doing your role in healthcare, that all goes into self-awareness. And your frame of reference, I've done a video about that in the past. Again, I'll leave the link over there as well as in the end of the video. And frame of reference plays a big part in this as well. So just watch that video and sort of try and connect the 2 of them together. But essentially, when you are much more self-aware, you will know what your strengths are, what are your areas of improvement, what steps you need to take in order to fill those gaps, so to speak, and what are the tools and strategies that you can incorporate as a healthcare provider to be of best service to your patients and also deliver them the best, most positive experience at all times. So self-awareness is everything. It's foundational. It's what I cover in my coaching program. I cover that in a lot of my content, or I'm starting to rather. So yeah, that is just everything. So if you're not self-aware, you're dead, as Gary Vaynerchuk says. So that's one of the main things. Number 2, I would say, is getting support from your colleagues. So I made this post on LinkedIn last year, and I mentioned it a couple of times as well. Healthcare is one of those jobs that you do not do in isolation. I mean, that's said for any job for that matter. Even for people who are like me, who are solopreneurs, who don't have like a team under them. For all of us, it takes a village, and that's what my posts on LinkedIn previously have been about. It takes a village. So villages don't just apply, as contrary to what people might think, villages don't just apply to mothers and parents. They apply to every single person. So for example, I have a village of people who edit my videos, who manage my website. Similarly, I have a village of people, like communities that I'm a part of, like the child-free community, my solopreneurs community. So just like that, teamwork plays a part in every single thing. So when you're working in any sort of healthcare setting, having a supportive environment is vital, because it's not only just so that you share the workload, that's one thing obviously, but also you collaborate with them, you work together, you learn from them, you teach them, you share, you exchange ideas and strategies and processes, and also get feedback from each other. So teamwork is very, very important. And I remember not too long ago, last month actually, I visited a healthcare facility, a very busy healthcare facility. I spent an entire day there. And I always knew at the back of my mind that healthcare, because I've worked in the industry as well, I have experience there, healthcare is a very team oriented and team based industry, so it's very hard to do this as a one man or a one woman show. But I really saw it in action when I was in that healthcare facility, because it was not only was it a very busy, intense place where patients were always, queuing up, and patients were sort of walking in and out of the facility all the time and getting their tests done and getting procedures done. But I could see very clearly how well bonded the team members were, how the colleagues and the staff members were, and how they would ask each other, how they're feeling. If they had like an idea or needed a suggestion or needed some support, they would just run past things from more senior experienced colleagues for feedback. And the senior people will also sort of ask, the other people, not just to delegate, but also to ask them, how can we improve things? So it was not hierarchical. Everyone was on the same plane, and I could really sense, a big vibe of collaboration over there. And that's why having a supportive environment, a unified environment with your teammates or your colleagues or your co-workers is absolutely vital, because even patients can actually see that when you're walking into a facility that, this is a lot of patients who might feel a little bit entitled, and they tend to be quite aggressive. They also have the sense that, they can't push their boundaries in a place like this. So they know that if you are, being disrespectful to a healthcare provider, there will be other people who will be backing them up and supporting them. So and also creating that environment of very strong teamwork and having good leadership is absolutely vital in order to deliver a really good patient experience. So if you notice the couple of points that I mentioned over here, it's not directly going back to the patient per se, it's about what we have to do as healthcare providers inside and out, because that will reflect and it will come through to our patients when we are working with them, and in a good way and in a bad way, and also in more or less an unconscious manner. And also it's very important that your team members are not only being supportive, but they're also cheering for you, and they have your back, and they are, they're rooting for you basically. And that's very, very. Number 3, is a big one, and this is what I covered during my interview with Dr. Dhruva. I'm going to leave again a link to that one over here. And I remember in that interview he spoke about, because he also specializes in patient service and patient experience, he talked about ACEs, not faces. So if you go back and watch that video, it covers that in a lot of detail. So, it sort of talks about awareness and empowerment and empathy and self-reflection, whole heap of different things. So again, I'm just going to leave a screenshot of what ACEs actually is so that you can understand what that is. Now, again, I sort of use that in a different purpose, repurpose that and use that in my like my videos and my posts and all that. So because this is his the concept that he came up with, that's why I'm including him and not taking credit. And number 4 big one is accountability. Again, on LinkedIn, I recently made a post about what accountability is. And this ties in very well with teamwork. So accountability is not just about, holding, if you are, say, a more senior person or a more experienced person in the healthcare space. And, you obviously you'll have performance reviews, on a quarterly basis, monthly basis, annual basis. That's one way of holding accountable. But also, everyone in a healthcare space, if you're working with patients, accountability is everything. You're not only that way keep staying on track of what you are, where you're going well, what you need to improve on, and how can you do that? And this is across the board. So not just for people who are your subordinates, but also people who are more senior and experienced. There is an accountability system put in place, and there is the bureaucratic system, but there is also a way in which when colleagues communicate with one another, there are ways in which you hold each other accountable, because doing that will give you much more clarity on what you should and shouldn't be doing when you are communicating with patients, and again with the intention of giving them the best service and also providing them the best experience at all times. And it also becomes a part of your professional development plan. So you'll know which areas that you need to really work on, and what further training and what further assistance and support that you need in any skill, be it communication, be it listening, be it administration, time management, anything. So whatever the area is, it sort of helps you identify those and also coming up with a plan on how you can work on them. And similarly, a lot of places where where the structure is not as hierarchical per se, the accountability system is much more transparent, and it's across the board, and it works for everybody, and that way, again, patients know what they're in for when there is a very strong and not a didactic, but a very supportive and empowering experience that holds everyone who's working with patients accountable. So these are some of the points that I covered in or the facets that go into providing patients an exceptional experience at all times through the service that we provide for them. So I will be looking at other elements at certain points, or maybe on a monthly basis or in time to come, but this is all we had time for today. So if you haven't already done so, make sure that you hit the subscribe button and the notification bell, and thank you very much for your time, presence, support, and attention, and share with me in the comments below what other elements do you resonate with when it comes to delivering exceptional patient service. So until next time, thank you very much, and I will see you then.